Okay, great. So at this point in the seminar, I'd like to talk a little bit about how we can actually physically test to see if a patient is under stress. We've talked about how you should discuss their medications during the interview and how you can use questionnaires. But in my office, what I really find most useful is really just letting the patient's body tell me if they're overstressed. Part of the reason I like to do that is because a lot of patients don't want to admit to anxiety, stress, and depression. So there's a couple of simple tests you can do, and they'll pay off for you both whether you want to deal with the patient as a stress patient nutritionally, or you want to deal with them as a patient who has chronic aches and pains and fibromyalgia. And they're very, very simple. So we're going to use a little demonstration right here. Now I use a manual muscle test, which means I take a strong muscle, touch certain points, and if it goes weak, I know that that is involved. So the first thing we're going to do is check a strong muscle. This is supraspinatus. And all I'm going to do is ask the patient to resist. Now I'm going to push down, and I'm going to use a good amount of force, but I'm not trying to overpower the patient. All I want to do is make sure that the muscles have integrity. Okay. So step one, muscle is nice and strong. Now if that muscle is not strong, switch to a different one, because we just want to make this easy on ourselves. Push up, and that one's strong. If that wasn't, I might check the bicep, the tricep. It doesn't really make a difference. Okay, and there's 3 steps or 3 tests we can do to make sure that the patient does have overwhelming stress that's actually causing physical complaints. The first one is to check the acupuncture meridian for the adrenal glands. This dot right here, is for the belly button, and you go about an inch up and an inch to either side, and you just hold it, and you see if the patient still has their strength. Push up, and this patient obviously loses all of their strength. Push up. Can you feel the difference?
Yeah.
Okay, great. Again, here's the belly button. You go an inch up, an inch to either side, and you check it again. And this is fairly accurate. If you were to go 2 inches up, push up, no problem. 2 inches to the side, no problem. Bring it into the 2 adrenal points, and very, very weak. Now again, you just need to explain to the patient, you're checking to see if the adrenal stress they're under, the physical stress they're under, the emotional stress they're under is overwhelming their neurological and their hormone system. If it is, the only way you're going to get them permanent relief is to deal with that using some nutritional supplements that we're going to talk about. There's another great test to use, and this is very important since we're chiropractors, and that's for ligament laxate. You have patients who come in with chronic ankle sprains and strains. My favorite one is if they wake up with headaches, or your treatments just aren't holding. Another one is that you treat them on Monday and they feel worse Tuesday, and on Wednesday they ask you not to adjust them. And that's because the ligaments aren't strong enough to hold your adjustment. That's a good sign that they're under a lot of stress, both physical and emotional. And again, you just take a strong muscle, push up, okay, and you give it a nice tug. Not overwhelming, you just want to make sure that the ligaments are being stretched. And then you check the muscle again. The arm goes weak, the muscle goes weak, you know that there's an issue you need to deal with. If you want to be doubly sure, 2 negatives in this type of technique really does turn a positive. So again, we're going to try this again. Push up, nice and strong. We tug, weak. We ask the patient to hold these 2 points, which we know are already weak, and we tug again, and it goes strong. And it clearly shows that this patient's adrenal system is overwhelmed and that they're going to have a very, very hard time getting over stress, depression, difficulty sleeping, fibromyalgia, chronic pain, headaches, all the things that show up in your office. There's one more test that's easy to do, and again, you just need a simple pen light. Face me. Push up. Again, check a strong muscle. And again, you can use any muscle you want. It doesn't make a difference. You take a pen light, you shine it very directly into the patient's eyes, and you have them check again. And the muscle goes weak. Shut the pen light off, check it nice and strong, do it one more time, and push. This is very simple. If you did all three together, it would take you less than 2 minutes during an exam, and you're able to link the emotional stress the patient's feeling with the physical cause. This will help you be a better chiropractor if you're dealing with aches, pains, fibromyalgia, and it'll help you be a better doctor because you can also address the stress and anxiety they're under from a biochemical and nutritional point. We're going to continue with the rest of the seminar now. Thank you.